This is Dr. Caudill Miller, Dr. Miller's Guide to Neurology, and we're talking about the seizure drug Briviact today. Briviact is a new drug that came out after Keppra, but it sort of targets the synaptic vesicle protein 2A, SV2A, that Keppra targets. And it's supposed to be more selective and have a higher affinity for this receptor than Keppra, so theoretically should be a better anticonvulsant. Briviact came out in a flourish, 5 to 10 years ago, and we used it, and then we just couldn't get it because it was way too expensive. And several years went by, and then all of a sudden it's sort of back, and the drug company developed a program where you can get it more affordable. So I can't really say I have a tremendous experience with it. I've had a handful of patients, maybe 20 or so over the years that have used it, and it's been a good anticonvulsant, but I've not used it thousands of patients like a lot of the other ones. But it's got the same side effects, drowsiness, dizziness, fatigue, nausea, sometimes vomiting, double vision. But you also need to warn them about the same kind of psychological problems you see with Keppra, and it may be a little more extreme with Briviact. Suicidal ideations, you need to tell them, listen, if you have any thoughts of suicide, and they go, oh my gosh, it's a drug and we just need to stop it. They have thoughts about dying, just, dropping dead. New depression or worsening of depression. New anxiety or worsening of anxiety. So that's my main concern about this drug, but you just got to tell people every drug has a skeleton in the closet. And I always tell them, listen, penicillin, we have 200 or 300 deaths a year from penicillin, but we still use it. But you just have to warn the family. You take penicillin, you break out in a rash, get short of breath, you got to rush to the emergency room. That's the skeleton in the closet with penicillin. So this is the skeleton in the closet with Briviact. It's definitely a drug we use for focal onset seizures, so it's definitely a good choice. And so give it a try as you work down the list, aiming for total seizure control. So that's Briviact. So like, comment, and subscribe. More later.